The Honourable Leader of the New Democratic Party.
Thank you, Mr. Speaker. A budget, of course, is an awfully important document. It's probably the most important statement of plan and statement of its mission that a government ever brings forward. The initiatives that we see in a budget are not just initiatives on their own. They're the means by which the government gives its signature to what it is about, what is its substance, what is its direction, its vision. So a budget not only in this sense describes the enterprise of a government, a budget also defines, it gives the measure, it provides us an underlying sense of a government in general. I think on the subject of budgets of my own experience a few years ago, working with and then having a chance to speak about the budgets that were brought forward by the government before this one. What a meaningful thing it was in April 2010 to be able to stand and vote for a budget which provided that seniors who received the guaranteed income supplement would henceforward not have to pay any provincial income tax whatsoever. I remember very clearly the sense of privilege around the budget in April 2012, being able to stand and vote for a budget that completely eliminated ambulance fees for everyone of low income in Nova Scotia. But budgets are defining moments. It was a defining moment for me in 2013 to be present for the announcement in the budget of that year that from now on, kids in Nova Scotia aged 10, 11, 12, and 13 would newly be covered completely under MSI for everything connected to their teeth. These were matters defining the political work of those years. Now, this present budget was brought forward the day before yesterday at a pressing moment, a moment of pressing sharpness in the lives of the people of our province. It's a moment of the health care crisis. It's a moment of the climate emergency. It's a moment of the urgent situation of family and household incomes. It is therefore hurtful, and it is something that, in my view, calls fairly for criticism, if not condemnation, that in this moment we are being presented with a budget that bears no sign of recognition that we are in a health care crisis. That we're being presented here with a budget that includes nothing commensurate with the scale of the emergency that is before us about the climate, and that we're being presented here with a budget which does not register at any level an awareness of the deep, day-in, day-out urgency of how many people's lives in Nova Scotia are entirely circumscribed by their unremitting struggle with not having enough to live. What we have before us, rather than something which would address these great, sharp crises of the moment, is rather a budget which is a bucket full of Band-Aids. We can think of the disappointment that confronts us in this budget on a number of levels. First, we can think of it on the level of the health care crisis. Overcrowded, chaotic, and untenable situations in emergency departments are being increasingly reported by frontline health care workers in communities all over the province. At the QE2, just a week and a half ago, nurses on the overnight shift were calling on the hospital and the administration there to declare code orange. That's a state of alert almost always reserved for incidents where there are mass casualties. At one point that night, it was the 13th of March, there were 99 patients in the department there. There were 3 doctors on rotation, and there were 3 fewer nurses than are required. That night in the department, there were 7 critically ill patients of the classification requiring one-on-one nursing, but there were only 4 nurses to provide that. That night, 42 patients left without being seen at all. That was here. Just the very same week in Kentville, Cheryl Burbridge, who's an LPN at the ER in the Valley Regional, she reported that conditions for working in the ER in Kentville had become so intense that she and the staff she works with were working at 200% over capacity almost every shift, that in her view, the situation had become dangerous and had become a violation of the fundamental standards of their nursing practice. On one day, members may have seen an article which was contributed just a few days ago to the provincial paper, which described this as it had been experienced by another frontline healthcare worker. On one day, this is in Kentville, just very recently, 24 patients had been admitted from the ER to the hospital, but there was no place in the hospital. And so the 24 patients that had been admitted to the hospital had to be accommodated in an ER that only has capacity for 20. Now, I should be clear about what that means. When we say that the patients had been admitted, that doesn't mean that they had been admitted through the triage system, that they had come in the door to the emergency department and been admitted by having received triage and then had taken a seat to wait. When we say that 24 patients had been admitted, we mean that they had come in, they had been triaged, they had waited, they had received the care that they had come for, and the emergency department was all finished with them. And had to send them to the hospital because they were in that category. They were going to go to the OR or to the ward or somewhere in the hospital. That's what admitted means in that case. They have room for 20 people that they have thus admitted, but that night there were 24. In Sackville, just in the last couple of weeks at the Cobequid, a facility which is set up to close at midnight, patients were being kept overnight. Therefore, of course, there's no provision for feeding them. So they were being fed from vending machines because the other ERs in the HRM were so overcrowded, there wasn't any place for those patients to be transferred to. Just less than a month ago, in North Sydney, at the Northside General, they were handing out in the ER flyers to patients who had been waiting there more than 8 hours, informing them that the wait was going to be a lot longer and suggesting that maybe they would like to come back the next day or maybe they would like to go to Sydney and see how they could make out at the regional ER instead. Nova Scotia has a new verb now, that is the verb to be pink-sheeted, as ER patients in the last couple of weeks have been handed pink sheets with instructions which tell them that they're being sent home because the ER where they are is too jammed up, it's too plugged up to take them. So that in Sydney, Dr. Meg Keating speaks about what she calls these are her words, nothing short of a crisis conditions at the regional. Dr. Jeannie Ferguson, also there, said of the situation, we're losing lives, and that's the bottom line. She remarked further, the conditions are starting to become third world, not first world. I'll table their printed remarks. Now, the primary cause for this, across the province, this multi-leveled ER crisis has been identified in the same way by frontline workers, by administrators, as well as by health policy experts in the field. And that primary cause which has been identified is that up to 20% of the hospital beds in the province are being filled at the moment by what are called alternate level of care, or ALC, patients. That is, patients who are not hospital patients, but rather they're people who have been assessed as not any longer safely able to stay home no matter what the level of home care. Therefore, they require a place in a nursing home, but there is no place for them in any nursing home. And the reason for that is that because at the height of the greatest aging tsunami in our history, the present government has not opened a single new nursing home bed in the 6 years since they came to power. With the result that emergency departments across Nova Scotia are double plugged solid because there's no place available in the hospital for them to transfer their patients into. Now, this is not a matter of one person says this, another person says something else, a matter of interpretation. the role of a large concentration of ALC patients in impeding proper patient flow in a hospital system is something that is entirely established. It's something that's beyond dispute. It has been clearly established, for example, by Accreditation Canada. And Accreditation Canada is the body that validates the work of our health authority itself. In our province last year, over 2,000 people lived in hospitals as ALC patients. Their average stay while they lived in the hospital was over 100 days. And surely it is a matter of significance to the government that this average stay of 100 days of ALC patients was 6 times longer than the average for other provinces in our country. So we face a crisis at this level, and there is a solution to the crisis enveloping emergency care in Nova Scotia, and that solution is simple: more new long-term care beds. It is therefore a matter of distress to a lot of people. It is therefore a matter of distress that the government, knowing this is the solution, should be bringing forward a budget this week which has no comprehensive program for new nursing home construction in our province. Now, no amount of talking about home care, no amount of purchases of mattresses and lifts, no amount of self-congratulation about what is projected to be built someday in Mahone Bay or Matagan or North Sydney or New Waterford. None of this will change the fact that by failing to invest in a comprehensive program of new long-term care construction in the budget, the government, by means of this decision, is condemning hospitals and condemning ERs and condemning paramedics to more of the intensifying and unconscionable state of being jammed up, blocked up, and overcrowded to which they are presently, this month, subjected. And no one should forget, when these matters are being discussed, the situation of those 2,000 ALC patients themselves. Like the member for Colchester-Musquodoboit Valley, I have done a great deal of visiting in hospitals of ALC patients as a minister, as I know that he has. Now I know, as I'm sure he knows, as many in this House know from visiting in nursing homes their own friends and families, that when you live in a nursing home that has got a good recreational programming staff, and you live in a nursing home that's got a strong volunteer base, and you live in a nursing home that's got a sense of community around it, that experience is not to be compared with living in a hospital as a patient but not a patient, where the doctors, when they go on rounds, sort of go by your bed as though you maybe weren't there, and where, when your family comes on the weekend, the top of the conversation is you're questioning them again whether anybody has heard anything about the placement that you're waiting for, and where, here in our province, you're apt to stay in that situation for an average of more than 100 days. And let's add to that the fact that ALC patients are paying, as they would pay to be in a nursing home, to live in these sub-nursing home conditions. I think about a woman I met by chance recently while visiting door-to-door in Halifax, Chebucto. She and her elderly father lived together, but he had had a couple of falls. He was in his 90s, and the time had come, she explained to me, where his care was going to be beyond her capacity. He was going to go to a long-term care facility, and she said that for him, this really wasn't a worry because he was a person of some financial means and he was going to be able to get a place in a nursing home very quickly, she felt. But as she was going through this experience, she said, her thoughts had been occupied with thinking about all the people of whom this wasn't true, who were in a situation in their families similar to hers. People who she knew, once they had got to the end of the road of what home care could provide, that they would have to wait in the hospital for several months or more because the government had not made the investments needed for there to be places for them to be able to get to. She talked to me about this, and as we were at the doorway of her apartment in her building, it was something that she was visibly upset. You know, she said, you asked me if there was any issue on my mind. Well, I got an issue. Let me tell you about it. She spoke about her father. She said about how this is bothering her, about all the people, she said, in Nova Scotia that have to be up in the QE2. She said that because they can't get into a nursing home. Now, I'm going to, Mr. Speaker, I'm going to beep out a part of what she said to me at the doorstep because it's not totally parliamentary. She said to me as we discussed this, Mister, she said, I don't want to hear any more of this balanced budget. Beep! And suffice it to say, Mr. Speaker, she was a woman with a pretty good talent for alliteration. I don't want to hear any more of this balanced budget. Beep! Because she said when the time comes that you need care, people ought to be able to count on getting care. I think, Mr. Speaker, that she has summed up a great deal of what, in the words of my friend Jason McLean, president of the NSGEU, she has summed up a great deal of what, as Jason said, is epically disappointing from the point of view of the healthcare crisis about this budget. There's a parallel level of disappointment that confronts us when we consider this budget in light of the present climate moment in Nova Scotia. For if we are in a moment which is increasingly defined by the climate emergency, as it has been set before us in such unassailable, monumental detail by the October 2018 publication of the Intergovernmental Panel on Climate Change's special report on global warming of 1.5 degrees centigrade. A report which has a wonderfully comprehensive title. The real title of that report is as follows: An IPCC special report on the impacts of global warming of 1.5 degrees centigrade above pre-industrial levels and related greenhouse gas emission pathways in the context of strengthening the global response to the threat of climate change, sustainable development, and efforts to eradicate poverty. Now, if that the IPCC report itself, in its encyclopedic grasp, reflects the scope and fulsomeness of that title. Now, if the whole report could be reduced down to one thought, as in fact the dozens of scientists who have put it together have attempted to do in its first page, that thought would be this, that, and I'm quoting, that limiting global warming to 1.5 degrees centigrade would require rapid, far-reaching, and unprecedented changes in all aspects of society. I'll table this. And that this, beyond question, requires a reduction of greenhouse gas emissions to net zero by 2050. Now, no international document could have a more defined and salient relevance for daily life in Nova Scotia. Here in our province, we can think of the summer of 2016 when throughout the western part of the province, wells went dry that had not failed in living memory. And we can understand what happened in western Nova Scotia to wells in 2016 in light of the fact that in the past 30 years, we have seen all 20 of the hottest years the world has recorded. And we can understand what happened in 2016 in our own province to wells in western Nova Scotia in light of the fact that 9 of the 10 deadliest heat waves in human history have occurred since the year 2000. Or we can think, as we think about the direct relevance of the IPCC report to our world here in Nova Scotia, we may think of the unprecedented flood damage caused in Sydney by the Thanksgiving flood in 2016. With its enormous life-disrupting and altering impacts for so many people. When we think about that flood, we can think about it in the light of how those same scientists in the IPCC report have identified our part of the world, Eastern Canada, in their section on impacts on human and natural systems. They have identified our part of the world as, and I quote, one of the regions with the largest increases in heavy precipitation events in the scenario of an increase from 1.5 degrees to 2 degrees centigrade global warming. I will table that part of their report. Or as we think about the relevance of the IPCC report to daily life in Nova Scotia, we can think of the vulnerability of the Isthmus of Chignecto, held together at this stage by not much more than a rail bed, and across which flows daily $50 million worth of trade. And lest anybody think that this is just an abstraction or something raising an alarmist point that has no immediate material connection for us, all we have to do is think about what happened in Churchill, Manitoba in 2017, where Churchill was, by floods, cut off from the rest of the country when the rail line was uprooted in those floods. And we can think about the fact that when the federal government last summer restored the connection destroyed by the floods to Churchill, Manitoba, it cost $1 million for every 6 residents of that town. So there's so many things for us to think about. We can think about agriculture. And we need to hold present to our minds what the IPCC says about this, that when you get from 1.5 degrees to 2 degrees Celsius in global warming, the rate of crop loss doesn't increase by 5, 10, 15, 20. The rate of crop loss doubles. Or we can think of the fisheries and the threat of species migration. Or we can think about it from the level of public health. When I say public health, I'm thinking in particular of all the issues surrounding Lyme disease. Now, my own family comes from Yarmouth County. When I think about Lyme disease, you know, it wasn't very many years ago when Yarmouth County was the only part of Nova Scotia that had any ticks. It wasn't very many years ago when people came to Digby or Shelburne County or Yarmouth County from other parts of the province in April or May, you'd have to explain to them, check yourself for ticks at that time of the year, and they would never know what they were talking about. You would have to explain to them what a deer tick was. But with global warming, we've got the whole phenomenon of species northern migration. On the basis of our own experience, we are compelled to look at what is said in the IPCC report. And it says there that all of this calls for what it calls, these are the words of the scientists there, a rapid escalation of the level of ambition in the work of emissions reductions, both from, it says, national governments and subnational jurisdictions. That means us, provinces. I'll table the place in the report where they said that. So no one could reasonably describe the climate change-related measures in this budget. Nobody could read through this budget and, in my judgment, reasonably come to the conclusion that although there are things there, of course, that have to do with the environment and have to do with climate, nobody's denying that, but nobody, I think, could fairly read through that document and say that it represented what the authors of the IPCC report have talked about as a rapid escalation of the level of ambition in the work of emissions reductions. That is the significance of the fact that the words climate and climate change don't appear in the document whatsoever. That's symbolic of the fact that the rapid escalation and level of ambition at the moment requires that the government in its defining document is entirely impervious to this truth. Now, earlier in this session, our party introduced the Local Action on Climate Change Act. This was introduced by the member for Halifax Needham, and in that bill that she brought forward, it was a piece of legislation that would establish a fund to support municipalities with the cost of climate change adaptation projects, like dike improvements and energy efficiency projects. But we look in vain in the present budget for the establishment of any such funding here. Our party has also proposed a Green Jobs Act to establish the policy framework for the economic mobilization that's going to be required in order for us to position ourselves in a dynamic, exciting way within the new green economy that's bursting out all around the world. We don't see any provision in this budget for anything that could be reasonably approximated to such a plan. We have here, rather, a budget from a government which is holding to an emissions target which nobody anywhere who is authoritative on this subject thinks is consistent with the goal of net zero by 2050. We have here a budget from a government which has taken an approach to global emissions, emissions reduction, which nobody thinks is commensurate with limiting global warming to 1.5 degrees centigrade, and which does nothing to fundamentally improve or alter that situation. I think of as I think about what the budget has to say on climate, a riveting phrase in the important book on this subject by a leading author on the subject who happens to live here in the city, Dr. Kate Irvin, book Carbon. She said it often happens in the world that governments don't really wish to do something adequate to the rapid level of escalation of ambition, so that they kind of try to dress up and present the business as usual scenario. These are Dr. Irvin's words. She says, sometimes business as usual dons the robes of meaningful action. That's another way of saying that what this budget offers on the climate emergency is paltry and puny and a dumpster-level disappointment. But there is no place, Mr. Speaker, in this budget, in my judgment, more comprehensively disappointing than the government's treatment of the urgent situation of household income faced by so many thousands of people in our province. Allow me to register in the House this afternoon a few facts which, in my judgment, anybody who wants to think in a straight line about the economy of Nova Scotia needs to grapple with, needs to be aware of, and needs to understand. All of which facts were entirely omitted from the Minister of Finance's falsely, in my view, triumphalistic discourse. Fact one, Nova Scotia is the only province in Canada where child poverty is getting worse instead of better. And this is not a random survey that somebody we know took working on a paper somewhere in college. This is this month the result of a study from Statistics Canada's Canadian Income Survey. And why wouldn't that be the case? Because fact two, Nova Scotia has the lowest, this is startling, I mean, not 7, 8, 9, 10 out of 10, the lowest median income in the country. Now, since this government came to power 6 years ago, in the country as a whole, median income has been rising. It has gone up over that 6-year period by 6%. In Nova Scotia, since the day that this government came to power, median income has risen by 0.27%. Fact three, RBC's Youthful Cities Urban Work Index, which was published last month, placed Halifax 20th out of 21 cities in Canada in terms of livability for young people. And the study cited as the reason for that a low minimum wage and the province's highest student debt levels in coming to that conclusion. Fact four, Nova Scotia has the largest percentage of its population of any province living in what Statistics Canada designates as low income. Fact five, according to figures provided by Hunger Count, Nova Scotia has the fastest rising rate of food bank use in the entire country. Hang on a sec. The fastest rising rate of use of food bank use in the entire country. And that means that 6,000 more people use food banks today in our province than was the case in 2011. That's a 31% increase. 2,000 more people use food banks today in Nova Scotia than in 2016. Now, I think it's fitting for us to just pause for a moment to think about what that means. The fastest rising rate of food bank use in the entire country. Here's what it means, for example, at the North Sydney Food Bank. In a visit there 3 or 4 months ago, Food Bank Coordinator Lawrence Shabib took me through the modest confines of the converted train station there. Now, as soon as you go in the door, you're immediately in the only room in the building where there's any room at all, and that's the room that's got freezers all around the wall, and it's got 10 chairs in the middle of the room. That's the waiting area. And that's all the chairs that there is room for there, 10. Now, the North Sydney Food Bank is open to its members 1 day a week. That's on Friday. And the North Sydney Food Bank serves 380 people. So think about it. There are 380 people, 1 day, 10 chairs. The upshot isn't hard to figure out. What's going to happen at the North Sydney Food Bank is that there's going to be a line, and it's going to be outside, and that's what happens every Friday. That's the case on Knock You Down Hot Fridays. That's the case on Freeze Your Tail Off Cold Fridays. And you look at that line, the line is long. It's got lots of kids in it all the time. It's got all kinds of disabled people in it. And as you inch your way up towards the door in that line at the converted North Sydney train station, the food bank, maybe a person might just not be in the mood to hear the government's economic self-congratulations delivered here on Tuesday in the address that was along with the presentation of the budget. Maybe as a person inched their way up in that line on the hot Fridays and on the cold Fridays, they might also not be in a mood to hear the government's often repeated claims that by holding the line on social spending, they're somehow looking after the interests of the children and grandchildren of future generations. It occurs to me, rather, that those future generations may well say someday, not, "Thank you, government, for your fiscal discipline," but rather something more like, "What kind of people were you that you thought it was all right to just allow this to happen?" Well, you didn't just allow it, pardon me, Mr. Speaker, for the use of the second person. It wasn't simply that was simply allowed. Rather, it was something that resulted as a direct result of policy choices which virtually guaranteed that would be a province with the fastest rising food bank use in the country. Here is a perfectly predictable formula for producing the fastest rising rates of food bank use in the entire country. Here's how you might do it. In a province where 20% of the population pays more than 50% of its income out in rent, well, the first thing you have to do is just fail to bring in rent control. Second thing is you'd have to impose an income assistance regime which was brutal. You'd have to impose an income assistance regime which was miserable. So miserable and brutish that IA recipients today in constant dollars in this province receive thousands less a year than those in similar circumstances did 30 years ago. And then you'd have to top that off if you wanted to produce a situation that had the fastest rising food bank use in the country, add to not having any rent control, add to having a brutish IEA system, add to that the lowest minimum wage in the entire country. The lowest minimum wage in the entire, but wait, whoa, I know. The budget before us on Tuesday says, oh no, that minimum wage, it's gonna go up. It's gonna go up to $11.55. That's gonna happen just on Monday. $11.55. So, Ontario, $14. Alberta, $15. BC, quickly working its way up there. The truth is that at this rate of a 55-cent a year increase for the next 3 years, in 2022, Nova Scotia's minimum wage is going to be lower than it is in those provinces today. And why? Because we have a government who think they know more than the consensus of the economics profession around this question, which is that a significant increase in the minimum wage will not only not result in a loss of jobs and hours, the Ontario numbers show this very clearly, will not only not result in the loss of jobs and hours, but will in fact rather lead to a spike and a stimulus in demand, which will in turn trend in the direction of economic expansion, an economic expansion that could have the capacity to make us something other than what we are after 6 years of the maladministration of this Liberal government, make us something other than the province with the lowest median income in the country, something other than the province, the only province in the country going backwards on the subject of child poverty, something other than the province in the country that's got the highest percentage of its people rising the quickest, who can't even get their food in a store but have to receive it on a charitable basis from a food bank. I think of a new book by an author named Stephanie Lund. It's called Made. The subtitle is Hard Work, Low Pay, and a Mother's Will to Survive. There's a commentary on this book, talks about what it calls, I think this is a stark, a wonderful use of words, what the writer calls the brute poetry of home economics. That's what's missing in this budget, an understanding of the brute poetry of home economics. And what is that brute poetry of home economics? The author goes on to say it's like this: rent plus groceries plus utilities plus laundry plus insurance plus gas plus clothing minus an hourly paycheck of barely more than minimum wage. We know what that equals. It equals the truth that an increase to $11.55 announced to nothing more than a paltry, sorry Band-Aid. But wait, the budget says, just a minute here, don't forget, we want to insist that, think about the increases that are provided here in the personal tax exemption. Oh, come on. It is the very definition of a paltry Band-Aid to provide a program to address low income, a program, the upshot of which will be an increase for people on low income of, this is what it is, an average of $13, a total $13 monthly. American country singer Casey Musgraves has a song called Rainbow, and in it she sings these words. She says, "It's hard to breathe when all we know is the struggle of staying above the rising waterline." That's it. It's hard to breathe when all our people know is the struggle of trying to stay above the rising waterline. That's the understanding that's missing here. Any sense of how hard it is to breathe for so many of our people who aren't able to see anything except trying to figure out how they can stay above the rising waterline, and will look to their government and its defining plan, its budget, to see what are they going to do. I'm reaching out and to see there's nobody reaching back. So we have before us a government that has no appreciation, no evident understanding of how hard staying above the waterline is for so many of the people of our province. A government who, with the budget that is before us, has defined themselves, in my opinion, and has defined themselves in terms of Band-Aids and disappointments. Thank you, Mr. Speaker.